Hi, it's Doug from Rise Above Performance Training. I got some questions asking how to deal with tendonitis, so we're going to go over that today, a few things that I do. The two most common areas to get tendonitis are medial epicondylitis or lateral epicondylitis, also known as golfer's elbow or tennis elbows, and you can also get patella tendonitis in the knee. Those are probably the most common areas. The first thing you want to do is just kind of address where it came from. Usually it's going to be a repetitive motion. You can get golfer's elbow or tennis elbow from things like playing golf or tennis, or you can also get it from just working at a desk all day long. Usually it happens when you're in the state of flexion a lot, where the arm doesn't get to be extended, or if you're doing repetitive motions, doing heavy baseball throwing and you're snapping your arm all the time and just wearing it out. So that's the first thing I'll look into, is just kind of where the source of the injury is occurring. The second thing you want to do is look at your technique. So if you are a pitcher or a soccer player and you get a little tendonitis, check your technique out. Have someone watch you, whether it's kicking a ball, or if it's in the weight room, if you're squatting and shooting the knees forward, or just the position's a little bit off, that could cause some tendonitis issues. So just have someone kind of check out your technique, and we'll have to work around it. So the areas of treatment, one of them you want to do is just some soft tissue work. Soft tissue work is basically just getting some tools to kind of get in there. So let's just say I have some elbow tendonitis, some golfer's elbow. I'm going to work a ball above, and what some people don't do is below. I'm going to get in that soft tissue area. I don't want to grind out right in that joint there, but I'm going to get it just above and below. So I'm going to put it just right here, and all I want to do is just kind of work it out. I can go in line with the muscle, or I can go kind of cross-frictionally, and I'm going to put it below the elbow joint as well and just kind of get in there. Like I said, some people just deal with the front part, and it could be coming from the other end too. So just kind of work that out. If you have it on the knee, roll the quads out. That's pretty common. Again, don't go too crazy. Just light rolls. I like to roll down the middle, maybe turn a little bit on the outside, getting pretty close to that patella without going over it. The other thing, so we went above, let's go below too. I don't see a lot of people rolling the anterior tib, which is on the outside border of the shin. So I'm going to roll and turn my leg in there, and I'm going to move, and I'm going to roll right in there just a little bit. I don't have to put all my weight on if it's really painful. If I can do it, I can really get in there, but just keep it easy. Roll about to the ankle and about to the bottom of the knee. So those are great to do before you work out, or even at night when you're done with the daily activities, to kind of get that tendon to relax a little bit. Then the next thing you do is stretch. So stretching, if you have some condylitis issues in here, what I like to do is kind of find a little point that bugs me, and I'm going to stretch. So I have my elbow flexed and also my hand flexed. So I'm just going to find a little point. I'm going to push on it lightly, and then what I'm going to do is I'm going to extend and lightly rotate. I'm going to find a new spot, extend and lightly rotate, and I'm going to find little areas that bring it relief. You can do it on the other side too. Extend and rotate, extend and rotate. So what we want to do is just kind of get that arm long, and I'm going to find maybe some slight trigger points that cause some issues. With the leg, it's a little bit harder to do, but I would definitely stretch out the quads and the hip flexors, and we've gone over these a bunch of times. You can, there's a bunch of ways of stretching out here. If you get the knee a little bit more, this might be a little bit more aggressive on that knee, but just kind of stretching out those quads and hip flexors. And what you can do is you can contract by pushing in your foot, a little PNF. So I'm pushing my foot into my hand, and then I'm relaxing and moving forward. PNF again and relaxing. So a lot of times when you release the hip flexors and the quads, that'll bring some relief to patella, so it'll move a little bit more. Last thing you do is strengthen. Now, I know a lot of doctors, I'll say rest, but rest means maybe taking time out from that activity and not necessarily doing, just lying on the couch and watching Sally, Jesse, Raphael. So for the elbow, just find exercise that work around it. Now I'm going to go really easy with the band, but you can do things like push-ups. If push-ups don't bug it, try some push-ups or something like that. Work around it by just doing light band work. So you can do rotator cuff. You can move up. You can move the arm across. So I'm getting this isometric kind of contraction, coming across here. I can pull through. If I'm feeling really good, I can get some elbow extension with some tricep kickback style. You can even do, curl up. Go with a light band, higher reps, maybe one good solid set of higher reps, and find areas that don't bug it and work around that area. And then you can save your weight training, like, if you have elbow tendonitis, you can definitely squat and other things, to get your core strength up. Now, if I have a little bit of a knee issue, one of my favorite ones is just doing the terminal knee extension. So I'll throw my leg in a band, get it just above my knee. Okay, it's a little slippery. And then I'll put this leg back so you can see. What I'm going to do is I'm basically just going to do a quad set, which is tightening the quad and straightening the leg. It's not too ballistic because I don't want to aggravate the tendonitis, but all I'm doing is squeezing and getting that little bit of extension and getting the quad to fire. Strengthen that up. Things that are going to be tough on patella tendonitis of the knee are squats and lunges usually, when it puts the kneecap in extreme flexion there. So we're going to do some extensions there, but also I like to strengthen the hamstring and the glutes. So I like to do things like single leg RDL, which I can have a slight knee bend, and all I'm going to do is I'm just going to extend down. When I feel a little stretch, I'm going to squeeze and come back up. Sometimes step up twos are a little bit more aggressive because they bend the knee a lot more. So this doesn't give us quite as much flexion on that leg. So I can just get a little stretch and come back up. If I'm feeling better, I can go lower, get slightly more knee bend, and then come back up. So work those a lot. That'll help strengthen the back part of the leg, and that, in theory, won't put as much stress on the front part of the knee because you'll have these muscles a lot stronger. So give those a shot, and hopefully that'll help your tendonitis pain. Thank you.